So the pathognomonic feature of this condition is sharply defined gray white to yellow necrosis of apical two-third of renal papilla. The opening at the tip of the renal pyramid is called the renal papilla. And the pathognomonic feature of this condition, there will be a sharply defined gray, white to yellow necrosis of apical two-third of the renal papilla. Like there will be a gray, white to yellowish color of necrosis of apical two-third of the renal papilla. Like we have renal pyramids like this. This is one pyramid. This is second pyramid. These are the renal papilla. So there will be apical two-third gray white to yellow colored necrosis of the apical two-third of the renal papilla. On microscopic findings. There will be a coagulative necrosis. As in definition of this condition, I have already told you people that this is called by ischemia, ischemic necrosis. So in ischemic necrosis, there is coagulative type of necrosis. When there is ischemia, there will be a coagulative type of necrosis. So there will be a coagulative necrosis surrounded by inflammatory infiltrate. When there is necrosis, there will be inflammation, and during inflammation, the inflammatory cells will migrate to the site of the inflammation and they will surround the area of the necrosis, and after that they will eat of the tissue debris, and the healing process will start. So this was all about the morphology of the pyelonephritis. Now we will move on to the clinical features of the pyelonephritis, acute pyelonephritis. So now we study the clinical features of the acute pyelonephritis. As we have already studied that acute pyelonephritis is always due to predisposing conditions, like we have say due to instrumentation, due to stasis of the urine, pre-existing renal condition with renal scarring, there is immunosuppressive therapy, if there is immunodeficiency, there will be acute pyelonephritis. During pregnancy, 6% of pregnant women develop bacteriuria. 6% of pregnant women develop bacteriuria, and among 20 to 40% of them develop an active urinary tract infection. From 1 year of age to 40 years. Urinary tract infections are more common in females, but with increasing age, the incidence of the urinary tract infection increases in males because of the increasing size of prostate. I say between 1 year and 40 years of age, the urinary tract infection is most common in females. But with increasing age, the incidence increases in males because of the increases size of the prostate. So this was something like epidemiology of the urinary tract infections. So now we will move on to the clinical features. So acute pyelonephritis, the onset of acute pyelonephritis is sudden in onset, and there is pain at the costovertebral junction. Like this is the vertebral column, and from there the ribs are moving like that. This is the posterior wave. So now here an angle forms, and this is the costovertebral angle. So at initial stage there will be pain at the costovertebral angle, and there will be systemic signs of inflammation like fever, there will be nausea, there will be chills, and there will be malaise. And along these signs we will also have localized urinary tract signs, which includes any idea?
No.
Dysuria, frequency,
Urgency.
and excellent, urgency. At the onset, there will be pain at the costovertebral junction, and as this is the inflammatory disease, so there will be systemic signs of inflammation like fever, nausea, chills, and malaise. And there will be also localized urinary tract signs like dysuria, frequency, and urgency. Mostly this condition is unilateral, but if the predisposing condition is persistent, so this condition can be bilateral and it can lead to the chronic kidney disease later. So this was all about the acute pyelonephritis. Hope you people understand. Thank you.